Hey everyone, welcome back to Shalonda's Nursing Corner. If you're new here, I'm a registered nurse, and today we're diving into a high-yield NCLEX topic, EKG rhythms and interpretation. Understanding EKGs is crucial for recognizing life-threatening arrhythmias, knowing when to intervene, and ultimately, saving lives. At the end, I'll test your knowledge with a quick quiz, so stay tuned. And don't forget, like and subscribe for more nursing content. All right, let's jump in! Before we jump into rhythms, let's break down the basics of an EKG strip. P wave, atrial depolarization, atrial contraction, QRS complex, ventricular depolarization, ventricular contraction, T wave, or ventricular repolarization, ventricular relaxation, PR interval, time for the impulse to travel from the atria to the ventricles, ST segment, should be flat. If elevated or depressed, it could indicate ischemia or infarction. NCLEX tip, a normal sinus rhythm NSR has a regular PQRST sequence with a rate of 60 to 100 BPM. Now let's go over the most important EKG rhythms you need to know. 1. Normal sinus rhythm, NSR, rate 60 to 100 BPM, rhythm regular, P wave present before each QRS, PR interval 0.12 to 0.20 seconds, QRS less than 0.12 seconds. NCLEX tip, this is what we want to see, no intervention needed. 2. Sinus bradycardia, rate less than 60 BPM, rhythm regular, P wave present before each QRS, PR interval and QRS normal. When to worry? If the patient is symptomatic, dizzy, hypotensive, confused, they may need atropine or pacing. NCLEX tip, bradycardia is common in athletes but dangerous in shock or heart block. 3. Sinus tachycardia, rate greater than 100 BPM, rhythm regular, P wave present before each QRS, PR interval and QRS normal, causes fever, dehydration, pain, anxiety, hypovolemia, or sepsis. NCLEX tip, treat the cause, fluids for dehydration, beta blockers if needed. 4. Atrial fibrillation AFib, rate irregular, P waves absent replaced by fibrillatory waves, QRS normal, concerns, blood pools in the atria, increasing stroke risk, treatment, anticoagulants warfarin Eliquis prevent clots, beta blockers or calcium channel blockers slow the rate, cardioversion if unstable. NCLEX tip, check ANR if on warfarin goal 2 to 3. 5. Atrial flutter, rate regular or irregular, P waves, sawtooth flutter waves, QRS normal, similar to AFib but more organized, still risk for clots. Treatment, same as AFib, anticoagulants, rate control, cardioversion if unstable. NCLEX tip, think sawtooth flutter equal to atrial flutter. 6. Ventricular tachycardia, VTAC, rate greater than 100 BPM. P waves, none. QRS wide and bizarre, life-threatening, can progress to VFib cardiac arrest. Treatment, if stable, give amiodarone. If unstable plus pulse, synchronized cardioversion. If no pulse, start CPR plus defibrillate. NCLEX tip, VTACH without a pulse equal to code BLUE. 7. Ventricular fibrillation VFib, rate, none chaotic electrical activity, P waves and QRS absent, no cardiac output equal to patient is dead. Treatment, immediate CPR plus defibrillation or epinephrine every 3 to 5 minutes, amiodarone if refractory. NCLEX tip, VFib equal to DFib. Never check for a pulse, just start CPR. 8. Asystole, flatline, no electrical activity, patient is unresponsive, do not shock, defibrillation, doesn't work on asystole. Treatment, CPR immediately, epinephrine. Check for reversible causes, H's and T's, hypoxia, hypothermia, toxins, etc. NCLEX tip, shock VFib, not asystole. Let's test your knowledge. I'll ask a few questions, and you'll have a few seconds to think before I reveal the answer. Question 1. Which rhythm has a sawtooth pattern? Answer, atrial flutter. Question 2. What do you do first if a patient is in VFib? Answer, start CPR and defibrillate. Question 3. A patient with AFib is at risk for what? Answer, stroke. Give anticoagulants. Question 4. What is the treatment for unstable VTACH with a pulse? Answer, synchronized cardioversion. And that wraps up today's NCLEX EKG review. We covered how to read an EKG strip, must-know NCLEX rhythms, emergency interventions. If this helped you, like this video and subscribe for more nursing content. Let me know what NCLEX topic you want next in the comments. Thanks for watching Shalonda's Nursing Corner. See you next time!